In the South Asia section of this research, the key findings can be broadly categorized under 2 points. The first is that minorities in this region are more likely to have poorer health than people from the majority community or the dominant groups. And secondly, that they have less access to health services comparative to people from the other communities. Now, I have to qualify here and say that one of the major difficulties we had in writing this report and doing this research was the lack of data on this subject. So you find it very difficult to get ethnically or religiously disaggregated data, and new and recent data is even more difficult to get. So that was one of the problems we had. In Bangladesh, in the Chittagong Hill Tracts, where you find the Juma community and other minorities, it has the highest incidence of underweight babies in this area. Indigenous communities also had a higher rate of malaria than other communities, and Indigenous and Christians had higher rates of diarrhea prevalence within their communities as against other communities. Now, in India, infant mortality rates for low caste communities and for Indigenous tribes is 25% higher than for other communities. And you see similar figures with regards to undernourishment of children in India. In Pakistan, maternal mortality is very much higher in Balochistan, which is a minority area. The figures are something like 758 to 100,000 in Balochistan, as against the national average, which is 276 to 100,000. And if you take Sri Lanka, the 4 districts which has the highest level of maternal mortality, they're all 4 are minority areas. Now, on the point of access to health, again, here we see that because for various reasons, partly because minority and Indigenous communities don't necessarily live in the towns and the cities, and they live in remote areas, they have less access to health. So the hospitals and the health centers are often in the towns and in the cities. And so in India, for example, you find in some cases clear discrimination. In a study that was done, it found that 21% of villages, there was no access for low caste people. So we're not talking about less access, we're saying that they just had no access at all to health services. And one of our partner organizations in India did a recent study on this and found that 10% of villages were preventing people from getting health access if they were people from low caste, so if they were Dalits. And we see this trend across Bangladesh, Pakistan, and Nepal, for instance, where minorities have less access to health services. Other areas of concern for minorities and Indigenous people in South Asia have, there's quite a range of them for the year 2012. I have to say Pakistan comes out as one of the deadliest countries for minorities in the world, and this has been particularly because of targeted attacks on the Shia community throughout the year. This happened in terms of bomb blasts to specific attacks where you had busloads of members of the Shia community that were pulled out of their buses, IDs checked, and they were killed. So that kind of targeted human rights violations against that particular community. But regionally, there are some trends we can see in terms of minority rights. One of them is the use of national security laws, and you find this in India and in Sri Lanka, where national security laws are used to clamp down on the rights of minorities. This could range from arrest and detention to affecting their rights to freedom of speech, freedom of expression. In India, the targets were mostly Muslims. The second one was freedom of religion. Freedom of religion is a massive problem across South Asia. In Sri Lanka, there was a wave of Buddhist fundamentalist attacks on minority places of religious worship and targeting minorities generally. Evangelical Christian groups were one of the targets, but last year we saw a significant round of attacks on Muslims, so burning down and attacking of Muslim places of worship, mosques, and also just mob attacks on Muslim religious sites and on Muslim business establishments. In Pakistan, we've seen attacks, as I said, against the Shia community, but also in Pakistan and Bangladesh, attacks against the Ahmadiyya community, which is a sect within the Muslim community who identify themselves differently. And with the Ahmadiyya, you see very, very clear cases of religious freedom being violated, where their places of worship are attacked and religious sites, including grave sites, are desecrated. In India, similar sort of cases of religious freedom issues. And in Bangladesh, again, there were attacks on Buddhist and Hindu places of worship and temples that we saw happening last year. Just two more points I'd like to highlight with regards to the general trends. One is that in South Asia, we saw last year that in countries where conflicts have not yet been resolved, minorities have particularly suffered. Sri Lanka again comes up here. There was really shoddy or poor attempts by the government at reconciliation. Hundreds of thousands of people who lost family members in the last stages of the war have yet not got any accountability, any justice, or no investigation to what happened. And it's 4 years since the end of the war. And you also have no political settlement or really anything significant being offered to minorities in Sri Lanka. In Nepal, we had the failure of the Constituent Assembly and political deadlock. And before Nepal went into this crisis, the big contentious issue that they could not decide on in the Constituent Assembly was ethnicity. So you can see in Bangladesh as well, in the Chittagong Hill Tracts, issues to do with post-conflict resolution. So in all these three countries, minorities have been affected by the failure to resolve ongoing conflicts. The main recommendation, I would say, for the region is the need for more concrete data. There was, as I said earlier, the problem of getting ethnically and religiously desegregated data. And as a result of this, it's difficult to draw a clear picture and to be able to address policies and practices in a targeted manner that can improve the situation for minorities. So this is a must, and it has to happen really fast. And you can't really make progress in this area until we know the picture clearly. The second thing I would say is to increase access to minority and indigenous people to health services. This would mean that possibly things like having mobile health clinics where the health services move to the communities if it is at the moment out of reach to the community. So if the community lives in a remote area and they can't come into the town or the city to have that access, then the health services move to where they are and they are provided with the access to health. The other thing is, of course, discrimination, because we've had many examples throughout the report where you have possibly cases where people reach the hospital and then they're discriminated on, they're not treated on, or you might even have discrimination at the level of governments deciding where to put their money. Do they put that money, invest it in hospitals in the areas where the majority community lives or in where the minority community lives? The discrimination as a whole has to be addressed. You have examples of people making their way to the hospital with great difficulty, sometimes having walked for miles and then finding the doctor doesn't understand the language they speak. So these kind of things have to be addressed, and I think discrimination broadly covers that. Those are the recommendations with regards to health. Generally, on improving the situation for minorities in the region, particularly that is focusing on South Asia, I think one of the points we seek that came out quite strongly in this report is you have countries where human rights violations are occurring in a climate of impunity. There's just absolute impunity in some of these countries. Governments just do what they want. There are very serious violations that take place and there is no accountability. And I think in South Asia now, the problem is that when you have governments who behave in this way, there is no further avenue to challenge them. South Asia is the only part of the world where there is no regional mechanism for human rights protection. And I think it's just time. There is no more waiting. We've just seen East Asia, ASEAN has come up with their own human rights mechanism, and South Asia is really falling back as a result of this. So in terms of minority rights protection and general human rights protection, there has to be greater commitment from states towards this, towards the concept of minority right, and I think a regional mechanism is critical at this stage.